Continue to have lots of questions about the COVID-19 pandemic, and a lot of you have been asking about a potential second wave of the virus and what that might look like. KOMO's Tammy Mutasa is live in the newsroom with the answer for us. Tammy?
Eric, it's hard to imagine going through this all over again, but our top health officials are warning it can happen, and they say we have to be prepared.
And we're going to have another battle with it.
The head of the CDC is warning a second, more vicious wave of coronavirus could hit our country later this year, colliding with flu season. Fergus Dockstader asked me this multi-layered question we're going to break down. What I can't figure out is, how can it make a second wave? Where is it going until then? How is it hiding until winter? How does the flu come back every year? How can it just be inactive somewhere?
This is such a great question. I've actually never been asked that question in this much detail, but I think it's a really good one because we haven't talked about this very much.
Dr. Elizabeth Mead with Swedish Hospital explains how viruses are constantly circulating in different parts of the world in different months of the year.
I liken it to a fire. So sometimes it can just be smoldering ashes, and then it can really come roaring back as it gets that oxygen boost. And the oxygen boost is really people being in close proximity to each other.
Which she explains how the flu comes back every year.
So viruses can come back as people start to spend more time in close proximity, more transmission happens, and viruses can mutate. So what you were immune to last year with the flu, you may not be this year.
CDC Director Robert Redfield warned that if COVID-19 resurges at the peak of flu season this winter, the healthcare system will be even more strained. To get ready for a resurgence, the CDC director says federal and state officials should keep encouraging social distancing, scale up testing, and contact tracing.
What we really are worried about is that if we have a big second wave of this virus in the fall and winter that coincides with flu season, we could see major influx of people that are sick that need hospital beds.
This is just a recommendation from the latest COVID-19 modeling here in our state, but I will say this, there are certainly shades of the governor's call to box in the virus.
I'll take the baked beans.
Inside J&L's Barbecue in Everett, a microcosm of what's happening here and nationwide.
You know, businesses like this, no offense, should be delivery only.
Greg, too, bristles over what is considered an essential business and what is not. And now word that new modeling recommends extending the stay-home order from May 4th to May 26th.
I think that got a little too vague and a little too messed up.
But for this barbecue manager who says it's hurt their Everett business big time,
I feel like it's a good idea. I just think we've gone this far.
A stay-home order for 22 additional days comes from the latest COVID-19 modeling from the UW Institute of Health Metrics and Evaluation. But whether it happens, that's up to policymakers.
Describe to us how you came up with that date.
So the date is based on the incidence of cases at that time. So on May 26, we will have 1 case incidence per million in our states. And we feel at that time that the local health department and the state health department is able to manage these 8.
Dr. Ali Makdad says after that, we could start to ease up on scenes like this, shuttered businesses and quiet streets, but only if the state has strong containment measures in place that include testing for case detection, the capacity to contact trace, and proper isolation plans.
The more they adhere to it, the less cases we will have, the sooner we could come out of it.
Our social distancing has made a difference. 1 month ago, our state was second in confirmed cases. Today, 15 other states have more cases.
Let's please stick around for a little bit more at home.
Washington State is building a brigade of contact tracers.
Where we're going to have 1,500 people, including members of the Washington National Guard, to work on that effort.
State health officials told me already hundreds are in the process of training to manually trace who has the virus and who could be exposed, which officials say will be critical in accelerating when and how society reopens.
The contact tracing initiative that we are embarking on now is really unprecedented for the public health system.
But soon this manual tracing could be reinforced with automated tracing.
At the end of the day, this is one of the biggest crises of our generation, and if we can add value that's new, I think it's important for us to do it.
Sham Kakade is one of about 50 people at the University of Washington, along with volunteers from Microsoft, working to build COVID Safe, the state's only contact tracing app to work with public health tracing efforts.
What's going to be important is finding a way to coordinate with public health officials so positives can be certified, and one of the functionalities is so public health officials can actually give broadcast to people locally and help with the manual tracing.
Kakade says the app will be voluntary and prioritizes your privacy, security, and civil liberties. It's about tracking the virus while you're at the grocery store or on the bus without breaching your trust.
This automated way of tracing is trying to send alerts to those people who are beside me. And what's nice about the way our protocol is working is it's doing this in a way that can respect the anonymity of individuals.
This will be given to students in Washington State for the school term. School closures are expected to last into the summer because, of course, of the COVID-19 outbreak, and that's forcing school administrators and schools and teachers to figure out how to grade students. KOMO's Suzanne Fawn joins us live. No easy answers on this test, Suzanne.
So this new grading policy primarily applies to high school students, and the state superintendent says the goal is to, quote, do no harm.
It's been a lot. It has definitely been a juggling act for me.
We first met Jenny Council last month at her home in Bothell. She has a first grader and a fifth grader in the North Shore School District who've been learning at home during the COVID-19 school closures.
The girls are really good about, taking responsibility for their work, but there's definitely some oversight that needs to be taken care of on my side to help them complete the assignments.
The question on many minds now is what happens to grades? Washington school districts now have a plan from the state on grading students. The state is offering a framework, but leaving it up to the school districts to decide if they want to go with a letter grade or a number grade system. One thing is for certain, no Fs will be given to students this term.
Fs will not be allowed. There will be no failures this term. No student who couldn't engage or didn't get access to the learning or couldn't quite make the progress that they wanted will receive a failing grade. Instead, it will be an incomplete.
We checked with different school districts to see what they're doing. North Shore School District is still deciding. So is Renton School District. Seattle Public Schools adopted a new grading policy Monday. High school students will earn either an A or an incomplete for this semester. Jan Capps has a ninth grader in Seattle Public Schools. She says the new grading system is fair.
I am not at all concerned about the grade. What I am concerned about is just making sure that the kids stay on track with the learning that they need and that they're going to be set up in a good position to be able to return back to the classroom in the fall.